We're taking back ownership over our own wellness and redefining what is useful. My name is Teresa Keto Dickerson, and I'm on a mission to change the conversation around the standard of acceptable. We're disrupting the way products are consumed and the ideas that we are in charge of our own wellness. Through connecting to community and professionals, we're clearing the path to live organically. This is an organic journey. I want to introduce you to today's guest. His medical degree came from the Chicago College of Osteopathic Medicine, and he trained in anesthesiology at the University of Chicago and completed his fellowship in pain management at the University of Michigan. With 10 years of experience, he currently serves at his state's Pain Management Commission as vice chair. As a consultant and specialist on pain, understanding the frustration and helplessness many find with typical approaches to pain management or when trying to work through chronic pain. Today, we have a real treat. All the way from Oregon, it is my honor to introduce you to a man on a mission to demystify pain through education, allowing people to finally hope. Dr. Kevin Cuccaro, thank you for joining us today.
Well, thanks for having me, Teresa. I really appreciate it. And thank you for that introduction. You really, that was not a canned introduction, meaning you actually did your work there.
Oh,
You've
yeah. Yeah, like I said, I'm trying to make like this. People need this. So this is my goal is to make this as personable and as true to life as possible. So I appreciate that. So before we dive right in, when I was on your social media prepping, I saw that you are working in radio a little bit now, and I love your quip about saying like you were a little stressed because you weren't sure when the commercial was going to start. You know, none of us are used to that anymore. So, when did you get started on this? Is this something you're?
Well, that was one interview I did. So I've done lots of different interviews, and
Okay.
my favorite thing to do, I actually like to do presentations and talks. So I've done tons and tons of community talks. And there was one radio kind of interview that I did, and it was
okay.
And that's a lot it's much more challenging because like what we're going to have now is we're going to have a free flowing conversation.
Right.
And what my experiences were with this radio broadcast is that all, you know, you're talking, all of a sudden it's like, we got to interrupt it now with a sponsor. And it's like, oh, we're just in the best part.
Right.
So that's really hard, particularly if you're somebody like me that can talk for a long period of time.
Right.
But now the rest of them, it's not my favorite media. I would say radio is not my favorite media. Podcasting, fine.
Yeah.
Video, fine. But
you like the speaking. Yeah, I did go on your website and saw that you had like a lot of different speaking things. I'm going to ask a couple questions around that because I'm really interested in maybe getting some salient points from that for people. So can you also, I saw on your page that you have actually been where some of us are. You've actually been experiencing some type of pain, like you experienced some type of pain. Is that what got you into this when you were in school or?
So I wouldn't say that. Well, if you're a human, you've experienced pain.
Right, of course. Yeah.
That's one of the most important things. Well, usually people are saying that is, are you someone who's experienced persistent pain for long periods of time? And I can't necessarily say that's me.
Okay.
Okay. And there's a host of different reasons for that. And then kind of deconstructing my past, kind of understanding that whole thing. It makes more sense, and we can talk about it. That all aligns with pain. Right. Now, from a pain perspective, like I want people to understand again, when I say if you're a human, you've experienced pain, it's 100% true.
Right.
The second thing it doesn't mean that anybody's pain is somehow invalidated by that statement.
Right.
And we can get into this, the judgments of, well, you're saying that someone's pain is better than other pain, or what's more challenging, I think, on my end is oftentimes people have a tendency, if they've had a long history of lived experience with pain, is if I say that I don't have chronic pain or I don't have persistent pain, right, and people say, well, you don't know where I'm coming from, and so how am I supposed to listen to you? I think that is extremely I understand how that comes from, because that's a very human reaction. But just because I may have not suffered for 40 years with a persistent pain syndrome, like it was experiencing the same type of pain every day for 40 years and then recovered from it, I can guarantee you the information that I can present, even because I've had mixed experiences with pain, will still be 100% relevant. It's sort of like the idea that people discount the idea that you can see a cardiologist if you've had a heart attack. But if the cardiologist has not had a heart attack, somehow that they don't know what they're talking about.
That's a good point. Yeah, that's a good point. Like,
Yeah.
well, obviously, yeah, that's a good point. I
Well,
mean,
and it's
well,
also it's a dangerous it's a dangerous sort of judgment that to fall into,
mhm,
because then what you start getting trapped to is people then, because you should be looking and searching and talking to the people who've recovered and done well,
mhm.
rather than staying with people who have not, just because their message resonates with you.
That makes sense. Right. You want to be around the people who actually can get you to where you're trying to get to.
And go. Yeah.
Right. Okay. Well, that makes sense. So, they'll tell us a little bit about your story, like what got you into deciding to focus on pain during your residency, I'm assuming, and
Actually, medical school.
medical school. Okay.
That far back, yeah. And one of the reasons, so I do a lot of work with clinicians. That's my
Mhm,
primary audience, is I'm teaching clinicians pain.
mhm,
And I always am talking to them about, why did we go into healthcare? Why is it
mhm.
that we pursued this career, whatever your background is, whether you're a physician or a nurse or a pharmacist or a physical therapist? And over and over and over again, you find people, and this was the same for me, as we go into healthcare is because we want to help people get better.
Right.
That's like the fundamental reason we do it. Now, somewhere in that mission, and different topic for a different time, when you're talking about medicine specifically, the training and the experiences, you start losing some of that, and now it's just trying to survive as a clinician to get through the system.
Right. Yeah.
But I had a fascination with pain pretty early on during my clinical rotations, and it, there's this. It's a fascinating subject. I knew I had to do. I guess I shouldn't say I knew how to do. I had this kind of gut feeling that there was much more to it than what was being presented,
Right.
and I love the human interaction, and that interest sort of persisted as I went into residency. When I went into residency, I went into anesthesia,
Mhm.
and so people, well, what do you mean anesthesia? They don't like people. They just put people to sleep. And that's like, actually,
Right.
that's not true. So anesthesia is another thing I absolutely loved, and you very quickly learn to try to condense very complex human interactions into a space of about 5 minutes, because you have to take someone who's basically terrified and then
Yeah.
get them into a space where they're feeling comfortable with you, they have positive expectations, and they feel, that they feel safe. That's like the key.
Right.
And so when I did anesthesia, loved that. But when I was rotating in the pain clinic, I kept coming out to this other thing, is there was something just more to it. Like, anesthesia is great, but one of this is an ego thing. Um,
Mhm.
if something goes well, the surgeon gets praised. If
Right.
something goes bad, the anesthesiologist gets blamed. And in
Oh,
both
wow.
scenarios, it may have been the anesthesiologist that things went really well
Right.
for, and vice versa. So that was pretty hard. It was probably the lack of control environment. So I decided I was going to do a fellowship in pain.
Mhm.
So I like the subject, and also kind of got me out of the OR at certain times. And there was a much more one-to-one interaction with our clients. Like, they knew me and I knew them.
Yeah.
Uh, I
And you're at
trained.
a person's like most lowest point, right? Like when you're in pain, like you're literally in like this low point. Like you're just so like you get that ability to just be with the person, during that time.
It depends on the individual, and it depends on the circumstance.
Uh-huh.
Because there's a spectrum there, right? So again,
Okay.
and we can get in this as well, as I don't see pain in a dichotomy of, some people say acute pain, and then there's
Mhm.
chronic pain. They're somehow fundamentally different. I don't see that at
Right.
all. I see pain as pain. All
Mhm.
pain is pain. And what changes is how these little different pieces come together to construct it.
Ah.
And so the reason that matters is because um, when we're saying someone is at their low point in pain, many people will assume, well, again, we're talking something like a persistent phenomenon. Someone has had it
Right.
for years and years, and had all these different types of therapies, and nothing seems to be working. They're not getting better.
Mhm.
But you can see somebody in what we would call an acute scenario, and it can still be a very, very traumatic, lowest point
Yeah.
of their life.
Right.
And so you have to look at the person who's in front of you in the specific situation that they're in, and address that, rather than and I just want to kind of make sure that we're seeing kind of all facets there at once. So
Right.
we're looking at the individual rather than any specific sort of pain complaint.
That makes sense. That makes sense. I mean, yeah, I gave birth, so that was one type of pain, and then I have my, my rheumatoid disease was a different type of pain. But, one of the things that is fascinating about pain, even from a person on the outside like myself, is that you actually need it. It's not something we could just say, oh, I never want to have it again, because pain actually is telling us something. Is that part of the science that you found out, that it's like there's actually a message that's happening here on our bodies when we're feeling when we're
Well,
feeling pain?
there's always a message, and it's really coming down to deconstructing what the message is.
Right.
Right. So if you did not ever experience pain, you would probably die, and you would probably die very quickly,
Right.
because we have pain, and you kind of just think about the body. And so if we talk from an evolutionary standpoint, basically everything that we have in our bodies and all these processes and how the way our brains work and all this stuff interacts, there has to have been a reason for it.
Right.
Right. So rather than this is good and this is bad, let's try to understand what the reason is, and then things start to make sense. And when you're looking at pain, like one of the fundamental misconceptions that people have about pain is they think that pain is about damage, that it's telling you that something is wrong with your body, that something's
Mm,
broken or damaged with your body. And that is not the case. And we know
okay.
that because if pain equaled damage, then every time that you experience pain, you'd always have some sort of physical damage to you.
Okay.
Counter to that, though, because we have to invert this stuff, that would also mean then if pain equals damage, then if you have pain, then if you don't have any body damage, then you can't experience pain. And we know that's not true. And people are like, Dr. Cuccaro, what are you talking about here? And I'm like, well, okay, so if we know that every time if we're saying every time you have pain is because your body's damaged, or we're saying because you have body damage, there's going to be pain. And I
Right.
ask you, have you ever had a bruise that you don't know how was there?
Yeah.
And people will sit back their head and they'll go, yeah. And I go, well, that's tissue damage. You've actually ruptured blood vessels. You've ruptured the muscle tissues, and the blood goes out. That's what causes that purpling bruising period.
Right.
But you don't have any pain associated. So how do we explain that? And they go, I don't know. And so you have to switch this idea. And if the listeners get nothing else out of this particular interview, would be this: instead of thinking about pain is damage,
Hmm.
think about pain as protection, because every pain is trying to protect you from something.
Something.
The question becomes, what is it trying to protect you from?
Okay.
And that adds into a little bit more deeper. But from you think about like a acute scenario, if you stub your toe
Hmm.
and you hit it real hard,
Yeah.
what your pain is telling you then is something occurred down here. We think it's in the toe.
Right.
It was sharp. It may have these other characteristics with it. But then your brain goes, okay, well, what else is happening? Okay, where am I right now? There looks like there's a step. There's some loose stones. Okay, this kind of fits with the picture. I might have smashed my foot into something.
Oh.
Then there's another component that says, well, have I ever been in a scenario like this before? Well, yeah, I've walked on steps before. Did I ever have something like this occur in the past? Oh, yeah, I had something else occur like that. And so you have the stimulation from your toe that goes up to
Mhm.
your brain, that you then start scanning the environment to look at all these other variables to say, yeah, this is sort of making sense. Then with this past memory and meaning, because pain's very important to memory and learning.
Right.
And we go, okay, yes, based on the past, based on this current information, the most likely scenario is this. Something might be occurring in this toe. Let's send this let's make a really intense sensation, and we have to make this experience so that we start protecting that toe until we know it's safe.
Got it. Oh, because the natural reaction is to be like, oh no, and like cover your toe,
Protect the
or like,
toe.
wow, okay, okay.
Protect the toe. And so what that also means, again, a real quick takeaway for
Hmm.
anybody out there, whether you're a clinician or non-clinician, is if you want to help somebody, no matter what the pain is and what the timing is, the first thing that you can do to help them is ask yourself, how can I help this person feel safe?
Okay.
Okay. And then people go, well, what does that have to do relevant with a broken toe? Or someone stubs their toe and they have to start pain with this.
Right.
I'm not a doctor. I can't, if there's a bone broken, I don't even know if it's a broken bone. I don't know how to set a splint. Well, you don't have to do that. You can help that person to feel safe, secure, so that they know that they're going to be okay, have expectations that everything's going to be okay. So you can say, hey, are you okay? You know what? I saw you take that fall, but it looks like there's no blood or anything like that. I think you're going to be fine, but just stay, don't move your foot right now. We're calling the paramedics, and they're going to be here in a little bit here. You're going to be fine. You're going to be okay. I am here with you.
Right.
And if you help them feel safe, that alone, even if the bone is broken, you're going to help that person feel better.
Okay, so now it's starting to connect the dots here for me. When I was doing my research, you were saying it's all literally the power of thinking. I get it now, because if that's usually like what we do with a kid when they hurt themselves, we're like, oh no, are you okay? And we're like, and all of a sudden, well, especially for a toddler, all of a sudden they jump up and they're gone. It's because that 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 mechanism that's telling us to protect something, we feel protected, so the pain is not as realized in our own heads.
Well, we'll talk about what I call the pain triangle in just a second here. But
Hmm.
if you're thinking about this and a lot of things coming together to construct pain,
Hmm.
rather than someone pokes you and pain pus oozes out of it,
Right.
it changes the game. Okay. And the kid one is another example. Have you ever seen a kid, particularly a young kid? We talk about pain and memory, right?
Hmm.
They fall down and hit the guard. I mean, kids can hit the ground really hard. I guess it's because they're closer to it and they're a little
Right.
bit
Yeah.
bouncy than we are as we get older, but they can hit it
Right.
pretty hard. And they're shocked and they're stunned, and they tend to not know what happens. And again, unless there's like blood everywhere and
Right.
cut up their finger, what's the first thing that a kid does,
They
particularly
look
a
at
toddler?
they look at you.
They look at you. Why are they looking at you?
They're trying to figure out, how should I react to this?
Yes. And we also know those parents. There's the helicopter, and this is not a judgment on parenting, but there's some parents that are like, oh my God, if my kid fell down, they probably just ruptured every bone in their body,
Right.
right? And then they're
Yeah.
like this, and the kid sees this,
And they
and
flip out.
they flip out because the kid's going from your reaction
Right.
versus other ones that may be, hey, are you okay? There's a little bit of concern. The kid's like, I'm not exactly sure. And then the kid starts to have to assess a little bit of the situation. And then if you let them get up and if, you're sort of being aware of them, but you're not neglecting them. At the same time, you're not over vigilant.
Yeah.
Then they tend to get up, brush their, and they're like, I'm fine. I'm out of here. I'm going to go.
And they're done.
Go.
Yeah.
And they're gone. Right.
Yeah.
So, in both of those scenarios, everything is 100% real. The difference is the level of threat that's perceived. Like
Got
in the
it.
same
Okay.
scenario, like I was, I can't remember how young I was, but we had these old single pane windows in our house,
Hmm.
and they used to get stuck. And remember it was the summer, we didn't have air conditioning. I'm trying to open this window,
Right.
and all of a sudden it went like this, and it smashed my finger into the window against the edge of
Oh.
it. And I was like, man, this hurts. And it's like the sharp sensation. I'm like, oh, yeah, that's kind of hurts. But then I looked down, and it had split my nail, and I saw blood flowing all over the place. And then all of a sudden it felt like my finger was on fire, and I'm crying for my mom and all this. Now, nothing had really changed in that moment in time other than I saw the blood and I saw
Right.
the nail. But
That
because
freaked you
that
out.
becomes so scary and so threatening, your brain is like, we got to really protect this thing.
Right.
And so then, then we add a little bit more element to there, and that pain fire blows up, and then we're seeking more safety, in which for me was, where's my
My
mom?
mom. Yeah. So how can we, so taking it to a person who is experiencing chronic pain, how does this, so how is this, what is happening there? Right? Like, is it, I mean, other than the fact, like, we get acute pain. I break my arm. Yeah, that hurts. We make the connection that my arm is broken. So what's happening with like the chronic pain? What's going on there?
So chronic, and I prefer the term persistent now, because if you
Okay.
kind of the forward people way out there in the pain world are using persistent, because chronic has this kind of disempowering nature about when you say chronic. And
Right. I
also
like
in a
that.
lot of ways that chronic people assume it's unchanging in some way. So persistent means
Okay.
it's been there for a long time.
Right.
No,
Okay.
persistent
Like
is
that.
different, meaning you have to look at the individual that you are in front of you and start talking about and talking with them more and asking more questions, because now it tends to be, not always, but it tends to be much more complex. Because remember we talked about there's what we would call sensation. There's a sensory element.
Hmm.
And so maybe actually I should probably talk about like something I'll call the pain triangle now. So,
Yeah. Okay.
and this makes what I love about the pain triangle is I was trying to take all this information, and you can't, well, I shouldn't say you can dumbify pain and make it into, this pain is we poke you and pain pus, that's acute pain.
Right.
And then
Yeah.
we have some of the pain, that's chronic pain, and we don't know what it is. We're just going to call it brain pain pus. Somehow it's in your head now. There's nothing you can do it. You just have to live with it.
Right.
And that's a wrong way to kind of think about it. Instead, we got to think like firefighters. And what firefighters do is firefighting can be very complex. There's some big fires that are very complex, and there's the very simple fires. But what firefighters know is that all fires have three basic elements that are involved in how they're constructed. You have to have fuel, you have to have oxygen, and you have to have heat. That's it. And if you have fuel, oxygen, and heat, and they come together in the right way, you will start a fire. And no matter how complex or how simple the fire is, it's always the same three elements. And what this allows you to do as a firefighter is that now, no matter how big or how small the fire is, if you can start deconstructing it to figure out what's the fuel source, how much oxygen is this applying to it, and what's the heat element, now you can target those elements in different ways safely and effectively to treat the fire. Meaning, some fires you don't want to throw water on. Like if you have an oil-based fire in your kitchen, you throw water on it, it's going to explode.
Right.
Other fires you want to throw water on because maybe they're wood and we're going to take away the heat element, right?
Right.
So understanding the nature of this fire becomes very, very important. Pain's the same. So instead of fuel, oxygen, and heat, though, what we have is the sensation, which is sort of like if something is sharp or dull, or warm or hot, or squeezing or taut, right? So there's that kind of description word. That's just fuel. That's not pain, because you can have something that is burning and you can build an experience of pain around it, or it can be actually pleasurable. Like if you like hot, spicy foods and you're eating something, all of a sudden your mouth starts filling up with a hot, spicy sensation. You'd be like, oh my God, this is spicy. This is wonderful, right?
Right. Yeah.
You hate spicy foods and now you eat the same thing and you have a burning in your mouth and you're like, oh my God, this, right? Different experience, exact same sensation from it. Okay.
Right.
So that's the fuel source for pain. The second element then we look at is the oxygen supply. And the oxygen supply is the meaning that we are now associating with that sensation. Meaning, and you kind of, from the burning in the mouth, it's the same thing. Oh, I love hot, spicy foods. So the meaning is this is hot and spicy food that I love it, versus I hate hot, spicy foods. This is something I hate. So that meaning there is huge. And that meaning is truly like oxygen to a fire. If you change that meaning, it can dramatically increase or decrease that pain. Okay. And then the last thing is the heat element. And that's all about attention and appraisal, meaning how much attention are you investing into that sensation for modes of different, and how are you perceiving it? Are you seeing it as what I call a challenge, or is it as a threat? Danger, danger, danger. Okay. Right. So in the same way, if we want to talk extremes. So you have a minor extreme, like I talked about with the bruise. A major extreme would be someone in the war zone. So pain is a protector. Pain is always trying to protect you from something. If you are in a war zone, though, where your brain sees bullets flying back and forth and there's bombs going off, and so that attention, that heat element is looking all over the place.
Right.
And now say you get shot or something happens to you. You may even feel a thud, you may feel like a bee sting. But in that moment in time, when your brain is so overwhelmed with all the danger and it says, I need to fight my way out of this thing, I need to run as fast as I can, or I need to freeze in my foxhole, would an experience of pain in that scenario of life and death, would it be a distractor or would it be a protector?
Be a distractor.
It'd be a distractor. And because of that, we now can run away, even if we have wounds to the body, because we're not going to experience pain because it's no longer a protective experience.
Wow.
Okay. So that's our three elements here.
Right.
And for when we're looking at someone who's had pain for long periods of time, the things that we need to know is kind of what's the sensation element. And the sensation, the number one people are concerned about, from a body perspective, because we've been trained to believe that pain's all about the body, everybody, 100% of the time, right? So if you're experiencing pain, there must be something going wrong. And if the doctors can't find something, well, they must not be looking hard enough because there's got to be something wrong.
Okay.
So we have more fear about that. We have this fear about the body. But fear is that meaning, that emotion that's attached to it. So as the more we increase that fear, then now we're increasing the oxygen supply to the pain fire. So if you have an experience or if you have a sensation, and now the first thing you think of is, I'm going to use rheumatoid example. You're having a rheumatoid flare. And what we know with rheumatoid arthritis or in the inflammatory spondylothopaths is that there's an autoimmune reaction. So the body starts attacking different bodily tissues. Now, why that occurs, there's a bunch of different reasons. Usually there's a high degree of stress related, either physical or emotional or psychological stress can trigger a flare.
Right.
But when you have that sort of inflammation, what that does in your body is it starts sensitizing the bodily tissues.
Okay.
That's when you start the swelling and you see the warmth and you see the blood flow going into it.
Right.
That creates a sensation that goes up to your brain. That sensation, depending on the flare, can actually be pretty severe. It can have lots of information going up.
Right.
But all that sensation is a fuel source. So if you start seeing see this inflammation, you have all this fuel, and the meaning is, oh my God, my rheumatoid is flaring. This is so awful. I hate this. I can't believe this is happening to me. I wish I had never had diagnosis of rheumatoid arthritis. This is going to mean maybe prednisone or all these tricky muds that I don't want to be on. And so we're thinking about all this bad stuff associated with it. Now we have more and more oxygen, which increases that fire. The other part about it is because the more that we see this as a threat, the more we're going to pay attention to it. So now, is it still there? Is it getting worse? Is it getting worse? So we're investing all this attention in it, and it can flare over time. And when we're looking at persistent scenarios, remember I said that pain is important to memory. Because when you have had something in your past, what the brain wants to do with pain is to protect you. It can protect you in the moment. So one of the things it can do is it brings attention. Sharp sensation brings attention. So it's trying to protect you in this moment. But the other best way is, how can it protect you in the future? How can it prevent any possible potential damage to occurring to you? And so what we now have is a memory associated with these sensations and other sorts of triggers. And when they recur in the future, now the brain's like, last time this occurred, this happened. I need to remember this. I need to focus my attention on it because this could be very, very, very dangerous. And so we start seeing these small triggers that can create a big, big fire, not because there's lots and lots of fuel, but because we have lots and lots of heat and oxygen. And the more oxygen you have, the bigger the fire that you can potentially have, and the faster that fire can flare. Does that sort of make sense?
Yeah, no, that makes a lot of sense. Sorry, my granddaughter is crying, so I don't want to lose that. Okay, good, perfect. So I was like, no, it's so good.
No, I cannot hear her, and I'm hoping she's safe. So.
Oh yeah, no, she's 2, so she's just crying. So, well, I mean, okay, so this makes a lot of sense, because I'm going to use my own personal example. You're right. When I start to experience a flare, it just, in my head, I'm just like, oh my God, here we go again. And like, you're right, I just start breaking down, like, I'm going to be out for a couple days, and like, it's going to be awful. I'm just going to be like stuck up. And you're right, I'm just like fueling this concept, like I'm just fueling it versus what though? Like what is the opposite reaction of that?
Well, the first thing you do is, and this is I love this particular question, and someone I did a lot of work with, and I love my students, my clinician students, and they take all your information, they apply it in great ways, and you're like, yeah, that's brilliant. Yeah. I wish I had thought about that. And so she's a physical therapist. Her name is Shauna Prasad. And what she has done is what she asks in that kind of more physical realm is, the question she always asks her clients is this. And she goes, with your pain, what is it that you're afraid of? That fear is the oxygen supply. And what you can, so when maybe you're having, or even you can do it now when you're not even in a flare. It's probably one of the best things about pain is the more you can understand it before you're in the middle of a really bad experience.
Right.
The less, well, a couple things, less likely to have a severe experience later on, and the more in control you'll feel. But you can ask, well, what are my fears surrounding my rheumatoid? Right. When I have a flare, what am I afraid of? And you mentioned a couple. I'm afraid I'm going to be in my bed for 3 days. I'm afraid this is going to get worse. I'm afraid, in start defining what those fears are. And that's a couple things. The more you define a fear, the less scary the fear is, right? I call it if you have a growling in the dark room and the light's off, your brain, in an attempt to protect you, is going to generate all the worst possible scenarios. There's a grizzly bear, maybe there's a polar bear for some reason it was imported, maybe it's a pack of wolves, right?
Right.
So all these uncertainties, and you're going to get worse. Rather than turn the light on, and let's say I think it could be this and this, but let's just turn the light and take a look, and then you may see it. Maybe it's a chihuahua, maybe it is a bear. Right. But the advantage is you actually know it's a bear, and you can do something specific to kind of deal with it. So I would define what the fears are. So in particular with that persistence scenarios, once you have those defined fears, and then you can start challenging those fears, because we make these suppositions that this is always going to, we hold that black and white thinking. Right. Because of this, I'm always going to have that. Well, is that always true? Right. Yeah. And so instead of saying this is what it's going to be, say, you know what? I wonder how this is going to be like. So that's another tool I learned from another one of my students, Leanne Deich. And she says, if you start approaching this stuff with a sense of curiosity, rather than a sense of fear, curiosity in of itself is actually less threatening, and it also opens up our options. So now we can say, so if I was having a flare, and actually I've done this with different types of things, is you have the sensation, and you're like, oh my God, that's intense. And then we always default to some sort of protective modality. We withdraw or whatever, and our brain starts going all these crazy places. First thing you think is, wow, this is intense. This is kind of cool because my brain's trying to protect me from something. What am I afraid of? I'm going to define that out.
Right.
And then I'm going to address those fears specifically through curiosities. Well, what would the opposite of be? Or how else can I think about this? Or because this occurred in the past, what can I try different this time? And if it works, great. And if it doesn't work, I know what didn't work, so
Right.
I can try something new.
Okay. So identify the fear around what's happening and then start applying curiosity around what's happening. So like I'm gonna use my example. I'm just like, oh my God, I'm gonna be stuck here, like in pain, and like I'm gonna miss X, Y, and Z or whatever. So if I stop and I'm like, okay, Teresa, you're afraid of missing out on something, or you're afraid of missing a deadline or whatever. And then I say, okay, so what my brain is starting to, or I'm protecting myself. So what am I protecting myself against? And I just start to break this down, sort of like how it would break down like a programming problem. I would just break it down.
And you're probably a lot better at it because you have a program background.
Yeah.
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 You can start what I call deconstructing this stuff.
Okay.
So from a pain triangle standpoint, what you can do is you actually can draw a triangle
Right.
and you go, okay, what's the sensation? It's sharp. And you're trying to use neutral language for the sensation. So it's not
Neutral.
aching or gnawing. That's an emotionally laden word.
Right.
Instead, you're saying this is like just the facts. Like what was that show? The Dragnet or whatever. And they're like, just the
Okay.
facts. Right? So
Right.
just the fact, it's sharp or dull. It's hot or cold. It's
Okay.
this or that, right? And you very, very simple, whatever the sensation is. Then you go to what we call as the motion side, the oxygen supply. Well, what is the meaning? What's the fear that's associated with this?
Okay.
Well, when I feel this sensation, I know that my rheumatoid is starting to flare up because, and this is my fears around it. I know this is going to get worse because, right? And then we go to the attention aspect to it. And what's the thoughts? What's the belief pattern that is associated? Why am I paying a specific amount of attention to this? And so that again becomes because of the meaning and because of the sensation. I know my belief is it's going to be bad. It's going to be worse. It's going to be
Right.
whatever. And once we start defining those, then you can start interrupting those at any place. Now, we're only talking about the emotional side right now. We're talking about defining your fears, addressing those fears.
Right.
Other fun things that you can do is from the attention side is how can you change your focus of attention? Because if we pull away the heat element from a fire, it also goes down. So in a flare of pain, when it becomes very difficult to have rational thought, one thing that you can do is use distraction. So instead of focusing on, say, the body part, you can pull your attention and look someplace else.
Right.
If you are in the middle of recovering from something, maybe you've had surgery, there's a reason that if you were watching engaging movies, and particularly positive engaging movies like comedies, that does a couple things. Those are not threatening, and it also draws you in. Like a really good movie or a really good external thing can suck your attention away that you don't even notice these other elements anymore.
Right.
I had a friend who had a really bad spinal cord injury, and one of the things that he noticed was if he was in these engrossing video games.
Okay.
And when you're really focused on something that's pulling your attention, and now you can't have any fuel or any heat to that pain fire down there. And that's actually leads into some newer therapies that they're doing in people with burns, because burns, lots and lots of sensation, right? Because you have all these tissues, tons and tons of information going up to the brain. Generally a lot of protection, and there's a lot of fear associated with it at times, so you can still modulate that. But the attention aspect, what they're doing, particularly with dressing changes, because if you've never been in a burn unit, it's difficult to be in there because they have to change the bandages, and the bandages stick, so they have to tear them off the bones. And so that they're experimenting with, again, these virtual reality, almost like a game. Well, they'll put people in it, and what that does is that pulls your attention away. And they have these games with like snowballs, and you have to be counting things. And so the more attention you weigh, the less you're paying attention to the sensations now. And as long as you have that heat away, you have less pain that you're experiencing.
Interesting. It brings me back to when I was in the middle of when I was in labor, and like they were like, oh, focus on something else, and they're like, oh, breathe or stuff. To me at the time was like, what are you talking about? I'm in pain, leave me alone, But like I see what they were trying to do there. They were trying to, turn me away from the fact that felt like I was dying. But okay, so I see. So the first thing we're doing, we're addressing what our fears are. We're trying to find ways to sort of break it down with curiosity. Then we're distracting ourselves, right?
Well, you don't have to always, but that is,
Right.
distraction tends to work probably best when you don't want to do any other work that much, or it's in
Okay.
um, so I see all pain kind of is pain. It just sort of depends on the event, but you can use
Right.
distraction and say you have a short-term thing. That's a really
Right.
easy one too, is what you're going to tend to focus on.
Right.
If you, it also matters what you're paying attention to. So if you're paying more attention to the sensation,
Mm-hmm.
that's different than investing more attention into the fear.
Got it.
So like here's what you break your toe. Let's just say you broke your toe, right? Sharp sensations going up to the brain. If you're investing a lot of intention now into this pain fire, but your attention is, this is awful. Oh my God, I'm sure my toe is broken. Oh my God, I'm gonna have to go to the emergency room. Oh my God, the emergency room is expensive, and who knows
Yeah.
if so we start adding in these other stressors, which may not necessarily be body related, but that's a significant stressor for some people.
Mm-hmm.
We're basically feeding our attention to that oxygen. So we actually have lots of heat and lots of oxygen now. If you focus just on the sensation though, and try to see that neutral, and this is a sharp sensation. This is a sharp sensation, and really focus as much attention just on the sensation alone. You still experience pain.
Right.
It tends to be a lot less than if you focus on all the awfulness that's associated with it.
Right. Because
So,
that's more the emotional.
and
Okay.
the labor area is a great realm, because there's not a lot of awareness, what I would call it. Like most clinicians actually don't understand the science very well.
Right.
We use this stuff, but they don't know why that they're using it.
While they're using it.
And so, like, if I had had you, like, if I could go back in time to when I was putting epidurals in people and I was doing cesarean sections and all this stuff, I mean, I
Right.
wish I knew what I knew now, because it would change the dynamic. Because there's little things. Like, I talked to a midwife once, and so when when you're delivering and you're having a vaginal birth and the head is crowning, right?
Mm-hmm.
That's big head, not the biggest area it's trying to push through.
Right.
Lots and lots and lots and lots of sensation.
Right.
Lots of actual protection, because pregnancy is actually dangerous.
Yeah.
But if you change the meaning to that sensation to something else, you can actually change the experience that we construct from it, meaning we're changing that oxygen supply. So if we go in and like, oh my God, you're crowning. Like, I'm a doctor.
Right.
Oh my God, you're crowning. It's going to get really intense, but you're almost through. But this is, I just take some deep breaths. This is going to be really intense, right? That's a different sort. Now I'm like, oh God, this is going to be intense. I can't believe
Right. What am I doing?
Doctors tell me it's going to be bad. Tell us this. You're crowning now. What these sensations are telling you is the baby is about ready to be delivered. Get ready. You're going to have your baby boy, your baby girl.
Right.
What are
Right.
we changing with that inflection now? We are investing attention into more of the excitement aspect to it. It's still
Yeah.
the same sharpened sensation, but we've flipped the script a little bit. And rather than, oh my God, this is something bad I have to go, survive through, it becomes, hey, this is an exciting thing, because what's
I'm
coming
almost done.
wild.
Yeah.
Same
Yeah.
sensation, same
Yeah.
sensation.
I like that because honestly, I had my kids natural. Honestly, I don't remember. I mean, I remember, but like you're right, that one moment, if the doctor had been like, okay, it's about, like, if you freaked me out, it would have been worse. But you're right, my doctor was like, hey, we're almost there. You're great. And I don't even remember the fact that that literally is like the most worst thing could possibly happening to me. But yeah, like okay. So people are doing this already, right? Like, so this whole concept around sort of like changing the experience of pain, it's happening in multiple areas, right, already.
Not
Um,
enough. Not enough.
but not enough. So what would you say? So you mentioned that you generally, your audience is normally for clinicians. And so what is it that you're teaching them to help those of us who would be on the receiving end of these clinicians? What are you saying to them?
So the more I can help clinicians to understand pain, period. Like,
Hmm.
just understand that pain is a constructed process. If you start to think about every single pain out there is having at least 3 elements to it. What's the sensation element? What's the emotion, the meaning, and what's the attention that we're giving to it, whether it's really a threat or a challenge? That changes the game. Okay. And then there's more to it, obviously, because then we go, well, what makes a brain more hyperprotective of a body? Well, that starts bringing in trauma experiences, because we talked about the link between pain and memory. And what trauma does is it makes your brain see threat and danger easier. So
Right.
the more past trauma you have, the more what we call, threat sensitive or danger sensitive your brain is. And from a clinical standpoint, what that means is then what you start looking at is, instead of, trying to check the box on this is this pain or whatever pain, it really is like, this is all pain. How is it put together? there's a couple of things that I need to know as a physician, or maybe a ER, nurse practitioner or whatever. I have to
Right.
make sure that that the body threats, we can rule those out, and we're pretty good at that. That's
Mm-hmm.
not that hard to do. But what that doesn't mean is that person's pain is illegitimate.
Mm.
What it
Yeah.
does mean, we have to start seeing the person in pain in front of us, start seeing it's how it's constructed, and how we target it becomes very different. Because the broken legs are actually not that hard. You put a splint on them, and if they're really severe, maybe you have to put a rod in them.
Right.
But if you can, even in a simple
Yeah.
scenario like that, it can be very complex, because if somebody's broken a leg, now they have a lot of anxiety. Maybe they have major depression on it. Maybe they have a history of early childhood stress where they've been beaten or abused. So
Right.
now we have this hypervigilant brain that's already in a place where it has trouble feeling safe to begin with. And now we're in a place
Right.
where we have a lot of body-based stress. We need to not only address that leg, but we have to address the attention and the emotion as well. How can we create positive expectations? How can we prepare this journey for them where they know this is a step-by-step thing? We want to reduce uncertainty. We didn't get into that at all, but when you reduce uncertainty, you reduce the experience of pain. So they know what to expect is going to occur, and that they have someone who's capable and competent to help them feel safe through that journey.
Right.
I'm not talking about any drugs at this point or anything.
Yeah.
So with the understanding of the science, what allows you to do is, if you are a prescriber, then you can choose and what medications you use, where you are going to use those specific medications, how long you're going to use specific medications, and most importantly, how you're going to frame those medications. So it's not just you write a simple prescription. It's
Right.
what are the words that you can use to increase or decrease that sense of safety that people have while using them. So that's just a long way to say is we can make this. We can take something really complex and simplify the framework to understand it in this triangle type, this pain triangle. Pain is like fire, fuel, oxygen, heat. And for pain, it's sensation, emotion, and attention, or cognition, as we call it. But understand that it is still complex enough, though, that we can start pulling apart each one of those elements to approach it in safe and different ways, right? It doesn't become this person has broken leg pain and we're going to give them a script, and this person has 40 years of back pain and they're probably faking it, because that's devalue. It invalidates the person in front of you. 99.999% of the times it's an absolute lie, because very few people are making up pain. Like,
Right.
I can think of one in my life that I think might have been, and I don't know because I'm not them.
Their person. Yeah.
But everybody else is the difference is, and this comes into the prescription there, but it's like the opioid thing, which I hate talking about opioids, because it distracts from the real conversation, which is, what do we know about pain and how can we help people feel well? Not, I'm trying to take this way or do this or what. We need to, if we understand the pain stuff, everything else makes sense. And from a clinical standpoint, it becomes very, very crucial, because most clinicians, and I'm talking as a fellowship trained, board certified pain specialist that had to go back to go, because the stuff I learned in fellowship, and I went at a pretty good, it was the University of Michigan. It's not what you call a slouch school.
Right.
I was a associate program director, but I had to go back and look and say, well, why is it that, we think we can just do injections and surgeries and prescribe pills, and that's going to make everybody feel better. And if they don't feel better, then we're going to say it's something wrong with them, that somehow that they're just a broken patient, and they, maybe they're faking it. Maybe they have secondary gain issues and all this other crap that we say, rather than saying maybe we're doing a poor job of understanding not only the science of pain, but how that person's pain is constructed. And that becomes very much a very humanistic way of approaching this stuff. Outside conversation, it's more difficult, because you have to have conversations, and our health systems are not set up to have good conversations anymore. But it changes the game, because now people can get well. We're not managing. Like, no one goes into medicine to manage garbage. Like, I've never wanted to manage misery. I want to help people get better. And when you understand the science of pain, we can do it. Is it a magic button that we can switch and everybody's going to be better overnight? No. But with a little work, time, and attention, you really can have some transformative results. And in our little region here, we have like people who've gone through programs in our area, who've worked with clinicians I work with, actually come together, and they get so excited. They're telling their friends and family about it, and they're creating these groups to support each other and grow. And it's beyond managing pain. It's really what we call pain mastery, and it gets really, really exciting.
I like that. So I have a question. So we talked a little bit. We talked about the science. And we talked about from a clinician point of view. And so from my experience, and also from where I'm trying to move in finding ways to not have to rely so heavily um, on like just like you said, pain management, or just trying to manage and like script it away. What types of things can a person do from a natural standpoint, where they're just sort of I like how you're talking about the thought exercises around, let's think about this, let's sort of focus on it, let's break it down, and just sort of find a way to, like you just said, master it. What other ways can a person, if they're just starting this, they're just not hearing you and hearing this like new way to think about pain, what can a beginner do from a natural standpoint?
Or we can from an action-oriented standpoint, right? So we're going
Okay,
to have to
action
talk about
oriented.
this stuff. There's a couple things. If you kind of sort of look at everything that you can do to help yourself get better from pain is everything that you can do to actually help yourself get healthy, period, right? And this is one of the wonderful things about this stuff, is because the side effects with drugs and medication, all that stuff, is like, you're going to take this pill and it's going to do this thing, but it's also going to be associated with headache, nausea, bloating,
Right,
constipation, or diarrhea, or maybe both constipation and diarrhea, and
right,
maybe some weird, maybe your lips are going to go numb, all this crap, right? All these
right.
negative,
You're gonna gain a ton of weight. Like okay. Well, thank
all
you.
this stuff. So from a pain standpoint, and this is not going to sound magical in any way, shape, or form. It
Right.
becomes healthy living, which goes along with your whole idea of organic living. What does that? What
Yeah.
does healthy living mean? You can break it down to really like 4 different things. First thing, you have to move. If you don't move your body,
Mhm.
our bodies are designed in such a way that movement is both a recovery and it actually helps them to grow. So you should be some sort of consistent movement every day. I didn't say exercise. What I said was
Right.
intentional movement. So it
Right.
can be as simple as a daily walk. It could be an exercise program. There's all sorts of them with the internet and everything else now.
Right.
But you have to move it. Like that old thing that we said, move it or lose it.
Yeah.
There's a lot of truth to that. And what's
Okay.
funny is the older that we get, the more movement that we need. Now, when people say, well, how much movement? I say, well, if you've never ran a marathon, don't run a marathon.
Right. Don't do
Try to
that.
walk
Yeah.
first, right? And so from a pain standpoint, if you're like, I would like to, it hurts when I move. Well, this is what you do is you find, again, pain's going to try to protect you from whatever. And if we start getting scared of movement, that's going to actually become a threat. So you go, well, I can't walk. How far can you walk? Well, I can walk about, 3 blocks before things get really bad. Okay, this is what I want you to do. For the next 2 weeks, I just want you to walk a block and a half. Why a block and a half? When you just told me that it's 3 weeks? Because your brain kind of gets tricky sometimes. And it's going to say, you know what? You're trying to do this less, but I'm still going to try to get you. And
Right.
so if you walk a block and a half, now you say, aha, you're flaring up, but you're just trying to be super protective, brain. I'm safe. I'm safe. I'm going to be okay. From a physical standpoint that you haven't really pushed yourself in the body where now you're, if you don't have a normal physical activity, if you try to accelerate it, then you have lots of extrasensory information because the body, the muscles are going to say, hey, this is a lot of information down here that we're doing a lot of stuff that we didn't have to do.
Right.
So you have it, walk, do that distance for a couple of weeks. And then next week you go, you know what? I did that pretty well. And out of all that time I had, you want to count your good days. You don't want to count the bad days. I had a lot of
Right.
good days. Okay. Well, then push it out to 2 blocks, push it out to 3 blocks. So you're doing the short stepwise thing. So movement becomes the first thing. The other thing from a natural standpoint though, is got to eat real foods. Well, what are real foods? Real foods are not processed garbage.
Yeah.
And I can't remember who said this, but if you can take your food and put it underneath the water faucet and it doesn't disintegrate, that's probably good for you, right? It's
Right.
probably okay. So real food just means non-processed stuff
Right.
that your great grandmother would have made for you.
Right. Right.
Uh, or Michael Pollan will say, eat food, not too much, mostly plants, right? So eat mostly plants. I'm not so much into the thing where I know the gluten, everybody's gluten sensitive, and pros or minus there. But the more you eat real foods, better off you're going to be. Sugar, if you have to point any figure at anything, probably sugar is one of the big ones. I
Right.
mean, you have to have blood sugar in your body in order to survive, but we eat too much glucose, and we know too much sugar is actually is a pro-inflammatory. So that's going to be a body sensitizer, right?
Mm.
So just eat real foods. Don't make it complex. Multicolored diet. The other thing is we call avoidance of toxins, or I would say environment. So just like you wouldn't want to live in a garbage dump, or you wouldn't want to live next to a radioactive field,
Mhm.
you have to choose your environment in such a way that you recognize that there are other toxic things other than places. There's toxic people. So what are your relationships with? 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 What are your relationshi Do you have toxic relationships? Are there people that are preying on you in the worst case scenarios, or making you feel more threat and danger? Are you having other in that area? Do you have people that you have connection with? Because connection is protective. Toxic people are dangerous.
Right.
Sleep. So we're down to number 4, sleep, right?
Right.
Are you sleeping? This is a big one with, modern lighting and the internet, both interfere with those. So
Right.
sleep also comes down to, are you having a consistent sleep schedule? The older that we are, the more attention that we need to pay to a sleep schedule, meaning you have to wake up at the same time every day.
Really?
Um, and there's the whole, there's when do you go to bed and how do you do it, and avoidance electronics and all that other stuff that you can read on the internet. But we have to be very, very attentive to our sleep. So moving, eating, environment, sleep. And then the last one that kind of goes with all of this is stress. And I kind of touched on a little bit with the environmental aspect of it, but it's how as we process stress. And so stress is another one of my fascinations, and I actually love, because stress physiology is human physiology. And stress and pain have the really tight relationship. So when you're under something what I call distress or threat stress, when you're feeling overwhelmed and everything is going crazy, you're more likely to also have your pain flare at that time. The opposite, though, because people say stress is, I don't want to be stressed. Well, just like you don't want to have, like, not wanting pain is not a good thing, because pain is a protector. Stress is actually really important to living, because if you have no stress, you will actually die too. You won't eat, you won't move, do any of this stuff. What we want, though, is more challenge stress.
Okay.
Right? So if you're starting an exercise program, you're not trying to hurt yourself. You're challenging your muscles. In fact, when we exercise and we're doing it effectively, the muscles themselves actually get little rips in them, little tears, because they're like, we go up to their range that they're used to, and then we exceed it. When we exceed it, we actually cause little microfractures in the muscle. We relax it and recover, and it grows in hypertrophy. So now it gets stronger and bigger and better, so that we can challenge it again. And stress is a very similar side effect. If you're seeing things as a challenge rather than a threat, how can I, what can I do? How can I do it? How can I get better? What can I try? And then you are, that's a whole nother topic on all the stress reduction techniques that you can do. But when you are, it's not the absence, but how can I turn this into a challenge? And then we have rest and recovery strategies as well. What we see is we start tolerating stress better. We start recovering from it faster, and it dovetails completely with pain. So I hope I gave you some good stuff.
Yeah, no, I think, like I said, so this is literally for the person who's just beginning and they're just like, where the heck do I get started? So coming up with some easy to do activities, like you said, actions to sort of get people started, to get them on this journey is very helpful. So I just want to say, like, thank you, because part of, like I mentioned, part of what I'm trying to do here is I'm trying to build a community around wellness, and I'm trying to help bring people content around wellness and natural organic living, and and the benefits that come from that. So I just want to thank you very much for taking the time to speak with us today. I feel very honored to even be able to speak with someone who's like, so I really wish that you were all over the country and you were here. I'm in Virginia, and like people were following what you've been teaching right here, because that would make things a lot easier for people everywhere. But thank you. I think now when we can go to our doctors and stuff, we can say, hey, I just heard this guy on this podcast, Dr. Kevin Caraco. Cuccaro. God, I did it wrong again.
It's
and we
okay.
can be like, you can be like, I really want to take a look at what this doctor's doing. Let's see if we can incorporate that. So, even so, it's been very helpful. So I really do appreciate it.
Well, let me add one thing on here, because the other aspect to this is you have to deal with the health system. Okay.
Yeah.
And what I'm talking about takes time, it takes effort, it takes energy on everybody's time. I mean, from the clinical standpoint, it takes time from them, but also from a patient, or what we call clients or community members, because I don't like patient means to suffer, one who suffers, and that's a disempowering term. But the more you can do for yourself, right? There's a difference between action and passivity. What action and active-based engaged strategies, all of which are better for pain, are ones that you are doing or for yourself, or you're working with someone so that you're improving yourself. Okay. Now, what this means when you go into your doctor's office, though, recognizing that they don't have a lot of time in most traditional practices,
Right.
you have to have some key questions to ask. And the key thing that you need, if you have a new experience of pain, what you want to know from a health system standpoint is there a significant physical threat? Now, remember, there's lots of different threats. All this
Right.
other stuff's involved. It doesn't mean one pain is more real than the other or one pain's legitimate. That's old garbage terminology. But what we're really good at in the medical system is to rule out physical threats. So we can rule out things like heart attacks pretty easily. If a bone is broken, that's super easy. If
Right.
the tissues have been torn and lacerated, that's really easy. Even if there's a cancer in those situations, they're really easy.
Right.
So you dip your toe in, though, when they rule that stuff out, it doesn't mean that what I want people to understand is you can still have pain without that physical damage in an acute or chronic setting. And so anything that you can do then to be actively engaged in it. So you go in, you see your doctor and say, I'm really afraid of this. That's another good form. So ask them, if you give them your fears, that gives them something specific to target.
Exactly.
I'm afraid it could be this. Now they can at least say, you know what, we did this and we ruled out cancer, or we ruled out,
Right.
you told me you're scared of that you think your leg is broken. Here's the x-ray. Your leg is actually pretty good. You still hurt. We totally understand you can still hurt with this, but you know what? At least your leg is safe, right? And
Right.
so we rule out those physical threats. Unfortunately, until things start changing, that means those other type of threats, the stresses, the sleeps, and all this other stuff, most physicians aren't going to recognize that. So it becomes incumbent on the individual to start engaging in that organic or healthy lifestyle even more diligently when once you've ruled out the horrible, awful, bad things, which is
Right.
really what medical care is good at.
Right. Okay. That makes a lot of sense. And so that's one of the main things too is giving people the tools to take ownership back over their wellness, because you're right, like even though the healthcare system is really good at figuring out, is your arm broken? Okay, no. And my mom always says, the ER is for the immediate attention, right? And so like after that, you've got to start figuring out, maybe my arm's broke, maybe my arm hurts because I slept on it wrong. Like, what I'm saying? There's all these different things we've got to like figure out, because it's our body. No one's going to care more than us because it's our body, right? And so you got to bring that to the doctor. So I appreciate that. I know a lot of times people are like, oh, modern medicine, but you guys are still people. We have to give you information for you to work with. So,
No one wants no medical system, right? I am
right.
pretty, if you've ever seen some of the stuff, I'm pretty aggressive against what I think we have a sick care system,
Mm-hmm.
but I'm not saying to get rid of it,
Yeah.
because it has a very small and very well-defined role. If you are having a heart attack, you want to go to a hospital so that they can put a stent in or plasty it or you get the blockage out so that you don't die.
Right.
The problem is, though, from a sick care standpoint, is once they've done that, the system is not in any way, shape, or form set up to help you to recover, to rejuvenate, and be better afterwards. That would becomes down to the organic and healthy living again. So
Right.
for 90+% of the stuff out there, you want to be living a healthy lifestyle, organic lifestyle, however we choose to label it.
Mm-hmm.
And for those 10% or less of those acute episodes, you go and you dip your toe in, you have them do what they need to do. But if you want to get better and recover, you got to focus on all this important stuff that it gets the sleeping, making sure you're eating the right fuel, that you're moving every day, that you're taking care of your relationships, you're addressing your stress in the right ways.
Which sort of wraps up everything, really, because we know we're more than just the physical. We've got all these other things that we're doing. So I appreciate that. Thank you again for sharing all of this wonderful information. And I did want to mention, for those who are not in Oregon, unfortunately, we can't go to you. You have a giveaway. It's called whywehurt.com. So if you go on this website, you can download this free program, and this will allow people. So it goes into what we've talked about today, I'm assuming. Yep. And
Triangle
yeah.
deconstruct.
And then because I honestly, I felt like I was like, oh man, I need to take notes and whatnot. So I'm probably going to re-listen to this and like take some notes or whatever. But yeah, thank you. Because I feel like understanding it a little bit more just makes it just a little bit easier to own your own wellness. So
And
thank
that's
you
the
very
goal.
much.
The
Yeah.
more that your listeners and we all can take more ownership and control and feel more empowered and safe and confident in our bodies again, the
Mm-hmm.
better we're going to be.
Yeah.
And anybody who tries to take that away from you and disempowering you and like takes away control of what you can do for yourself, those aren't people that I would hope people stay with for a very long time. Because
Right.
if you want to get better, it's going to be really the key mediator, and you getting better, the most important mediator is you.
Yeah, because it's you, it's your body. Well, thank you very much. I kept you long enough. I appreciate you spending all this time with us, and I hope, I don't know what time it is in Oregon. What is
Latest,
it?
it's only
It's
4 o'clock here.
it's only 4, yeah, so it's like dinner time here. But but thank you so much. So I'll let you get back to your day, and I appreciate everything you've told us today.
Well, thank you, Teresa. I really appreciate it, and good luck to you in your journeys. And it was an absolute pleasure to talk with you.
Ditto, absolutely. All right, have a great one.